on the Ramadan, which is approaching on the 23rd, and the famous mentioned already risk assessment and decision tool is also online as we speak. And the second is to see for a moment the perspective of the athletes, or the perspective of those people who do physical activities, and how the reflections on physical activities overimposes, like for travel, like for physical, public and major, physical distancing, all of those we are all experiences overlaps with the topic of mass gathering. In order to introduce and to explain better what I mean, we asked Dr. Fiona Bull, which is just a colleague and a dear friend, but leads the physical activity team here in WHO. We should have a list of experts that usually can answer your questions. Some of your questions you already formulated and send it to us. Thank you for that. And Fiona.
Well, thank you, Mauricio, and a very good morning and afternoon and evening to those joining us. It's a great pleasure to join you, Mauricio, and your team for this WebEx, this regular forum that you hold. And I'm delighted that you've chosen this topic to bring to the forum the very important issue of staying active for all the benefits, short and long term. And some of the responses to COVID, of course, are creating much new environments, new contexts for us to think about helping everyone to stay active, stay healthy. So I'm very pleased to join you, and I'd be happy to contribute through questions and the dialogue over the next hour. Back to you.
Thank you so much, Fiona. So
there is Brian online. Yes, I see him. Brian, you want to explain in 3 seconds what the new guidance consists for sporting event? Over.
We just put you on the spot, Brian. Sorry about that.
I've just been knocked out and re-brought into the meeting, so I'm just trying to get things sorted out. Can you come back to me in 2 minutes?
Yes, and it was Sarah's ideas, of course. Never mind. Okay, Sarah, let's go with the update of the EPI.
Thank you. So we're going to do a quick update of the numbers. So if you're joining the call from your computer, you should be able to see a presentation shortly. So I'm just going to put that up right now. As of today, we are seeing approximately 2 million cases of COVID-19 globally in about 212 countries, areas, or territories. So much of the world is affected by this pandemic at the moment. Unfortunately, we have over 120,000 deaths. The top 10 countries with the highest number of cumulative cases are to date the United States of America, Spain, Italy, Germany, France, the United Kingdom, China, the Islamic Republic of Iran, Turkey, and Belgium. So still a very Eurocentric pandemic, with, of course, the exception of the United States of America. We can see by WHO region as well, the region that is the most affected in terms of total number of cases. The highest burden is, of course, in Europe, with the Americas closely following, and then the Western Pacific and the Eastern Mediterranean. I think that's it for the numbers. We do have a slide here which I think reiterates what Maurizio was talking about in terms of the guidance that was available. Is there anything that you missed that you'd like to refer to on this slide, Maurizio?
No, but I would like to draw the attention of the colleagues that the last 4 points are all new. So, for instance, many of last email before joining the webinar was to ask the IOC, Richard Budget, the Chief Medical Officer, and the whole system of sports federation to also take note of the Ramadan guidelines, because many of the athletes and many of them are also observing the Ramadan. So the sport, as we have been saying from day one, the whole sports planet is so well integrated in the society that it can and often is used and listened by the people almost more at times than the politicians, and this is a good thing. There is another technical observation that I need to share with the colleagues and friends, is that we have still a lot to learn. It's a new virus, and some of the numbers and epi curves that we see are yet to be decrypted. For instance, there is if you observe the average age of the countries like Spain, Italy, and Germany, whilst the depth of the coronavirus overimposes perfectly to the profile of the population in Germany and Spain, in Italy, for instance, there is much larger proportion of death the proportion of age for that group age. So there are some factors that we have yet to understand, whether there is a measure taken, whether there is a treatment problem, or the clinical. So there are several things, there are serological tests in progress, and they will help us to understand how this virus passes through the populations. So I stop here, and unless there is Fiona O'Brien or they want to add something.
Mauricio, no, not specifically on those set of guidelines. We're very pleased to see those coming out. And I'm sure there's going to be some discussion and questions about possible forthcoming guidelines and areas of interest, which I know you've already started discussing about application of those principles to some of the other settings relative to the promotion of physical activities, for examples in the sports settings and gyms and clubs. But I'll leave that for prompting by the audience if that's a line of questioning and discussion we wish to pursue. Obviously, WHO has already put out some frequently asked questions material on physical activity, and I draw everyone's attention to the COVID website pages of WHO to access the information and reiteration of the importance of physical activity and some of the principles and examples of how to be active during stay-at-home response options and with this confinement and restrictions. Those materials are available on the COVID websites. Thank you, Mauricio. Back to you.
Okay.
Sorry, I see also Rosamund online. And maybe, Rosamund, you want to add something on the EPI situation and what are the next steps that the response to Passage is going to, in which direction the response is going?
Sure. Well, that's very different depending on which region you're in. As you've already pointed out, Europe is at the center of the outbreak at the moment, along with North America, but more specifically United States of America, and continues to be on the upswing in Africa and parts of Southeast Asia and Western Pacific, but also in the Americas region in Central and South America. So the world is still in very different stages of this outbreak, and we don't know yet from an epidemiological perspective exactly how it's going to unfold in countries with overall younger populations. So in theory, the younger population should weather the challenge better, but also there may be populations where there is less resilience, community resilience in terms of being able to work from home, having your income continue to flow. And of course, that's true for all societies, but it may be more true for societies where the informal economy is larger, and therefore the impact of the epidemic may be greater because of less economic resilience of the countries, but also of the individuals themselves, more difficulty to access food, although markets are, of course, open. So there are many, many considerations. And the other one, epidemiologically speaking, since you specifically mentioned that, is the potential impact of other, what we call comorbid conditions or underlying conditions that don't exist to a very great extent in the countries that have already experienced the upswing of the pandemic. And that, of course, includes malaria, tuberculosis, HIV, malnutrition, and then the insecure settings where war and insecurity remain everyday threats. So we are still extremely vigilant on monitoring how this is evolving and supporting countries where we can. But some countries, so the good news is that some countries are beginning to see what China saw, which is a decline in the number of cases. So of course, China went all the way to zero in terms of endemic cases, locally acquired cases. Most of their cases today remain imported cases from countries in Europe and elsewhere that are newly suffering the outbreak. What we've seen so far is that it seems that the downward curve in Western Europe may be less steep than we saw in China. So, for example, the movement restrictions in Wuhan and Hubei province were quite stringent, and that allowed the curve to come down more quickly. We are seeing that other countries where movement restrictions have been put in place that may be less stringent, less door-to-door provision of food, for example, means that the outbreak on the downward slope is actually slower. It's the waning part of it is slower because new infections have continued to occur, whether through hospital infections or infections in the community, so that it's going to take longer. And this is why WHO has now put out part of the information in the updated strategy is how to start lifting measures, and a number of considerations come into play. What is the epidemiology? And this is relevant, of course, to you for physical activity and for sporting gatherings. So how to start lifting activities, how to start lifting restrictions. It's got to be tailored locally. It's got to be tailored to the epidemiological situation, to the capacity of the public health sector to cope with detecting new cases, and therefore tracing contacts so that people can continue to be quarantined or isolated in their homes or in facilities where appropriate, while other measures are lifted. Because if we don't continue to do contact tracing, then of course we'll see a dramatic upswing locally or nationally in countries that thought they had put the outbreak to bed. So the lifting of measures is going to have to be done extremely carefully. So as a sporting group, well, I just literally moments ago received information that my own son's football season has been declared over and is not going to resume. So obviously there's going to be many people who are going to be disappointed. But that doesn't mean that we can't keep planning going forward and supporting the steps that you take in on a case-by-case basis, starting to open up activities at a local level, country by country, region by region, local area by local area, and then globally as well. So that's a different discussion, but I just wanted to put the spin on it that I think you were looking for, Maurizio, which is that we are seeing good news, but it's coming slowly. And there are many countries that have yet to experience the peak of their outbreaks, and then the ultra vigilance that we need in lifting measures to ensure that new outbreaks don't lead to widespread disease again. Thanks.
Thanks so much, Rosamund. We're getting some comments in, so I'd like to just remind people, if you have a specific question for one of our experts, Rosamund being one of them, Maurizio being another, and then some others that we have who have drafted the guidance that we referred to earlier, please put it in the Q&A function, because when it's in the chat, it's easier to miss. So if you do have a specific question, please put it in the Q&A. And with regards to the links in the slide that we spoke to at the end, we will share that to everybody who registered to the call after we finish. Maurizio.
That's it. Let's go directly to the questions, because that is where the thread of the conversation is more exciting.
Thanks, Maurizio. So perhaps what we will do is we have the questions that we received over email prior to this call that we will try to address first. So we have two that I think were specific to Fiona. The first is, do you think that the continued lockdown around the world is negatively or positively impacting exercise and physical activity? And linked to that is the second question, will this require us as sports scientists to become more creative and adaptive in the methods and perhaps technology we employ to promote and prescribe physical activity? Over to you, Fiona.
Well, thank you very much, and thank you for those questions. The short answer for the first, is it positively or negatively affecting, would be, we don't know for sure. And the second question, in terms of do we need to be creative and adapt, will be yes, definitely. Let me return to those questions and expand on them. It's a really important question about whether the impact is negative or positive. And I think everyone has got their own experiences, themselves, their family, and their local communities. Some of the most active will be looking for ways, finding ways, and making sure they stay active. They may increase with more time. There'd be many who may see this opportunity, the time they have at home, with the change in work environments, etc., to look and try and be active. There's a lot more time and there are more opportunities coming to the fore. But of course, the biggest concern is that these constraints are actually reducing levels of physical activity. Most and many of us are not active predominantly in our home. We look to get out, to join clubs, sports, activities, to use the local community, parks, and to walk and cycle, whether for transport or for recreation and fitness. It's quite likely that those levels of participation are declining, and it's unless you look for the alternates and substitutions and adaptions, then levels may be going down at the population level. So I think the question actually is flagging a very important research question, one which WHO has been discussing in the recent weeks, and will be pursuing to see how collaborations could capture real time the changes, as my previous colleague was mentioning, over the course of COVID and the response, which will be some months. And as we reopen and adapt, there'll be new circumstances, and we just don't quite know. And we need to know, we need to learn from this so that other countries can follow best practice, effective practice. So let me turn to your second, if I may extend the answer just for a moment more. Can we adapt? Should we adapt? Can we be creative and use technology? Yes, yes, yes. It's really inviting those professionals in this area, across from sports clubs, sports trainers, coaches, club, and fitness and exercise professionals, and the community, to be inventive, to share ideas, to motivate ourselves and our families to stay active. And we're seeing it. I think we've all seen the amazing response of professionals getting out into courtyards or rooftops and leading their community, and of course on the live streaming of different classes to join in. And indeed the industry responding by sharing those resources, opening up beyond paywalls and registrations and saying, use what we have. And that's just a fantastic response to providing more opportunities to more people. I just hope and really invite us all to think about, are we reaching everyone? Those who are less active and need a little bit more of a gentle start for safety and their own level of fitness, the older individuals and those with maybe a disability or chronic disease. Some of the core material that might be ready now may not be the most accessible for some of the really important groups of people we want to make sure, and obviously culturally appropriate and in different languages. So yes, we need to create, adapt, tailor, translate, share. We do need, as Dr. Tedros say, to unify and just all hands on deck to help people stay active for all the benefits. Back to you, Sarah.
Thanks very much, Fiona. So let's move on to some of the other questions that we've had come through. We have some questions from Thanos, and I believe, I probably get the acronym wrong, but I think the International Triathlon Union. How do you see the exit strategy develop from this crisis? What would be the recommended steps? I know Rosamund has been looking at that quite closely. And then when is the best time to perform the COVID-19 risk assessment tool for an event? So probably
I will give back to Rosamund and Brian, but I need to have a broad disclaimer to everybody, colleagues and brothers and sisters. We are here chasing the virus. We are not chasing human beings. When we isolate somebody or when we make that technology, we are doing that in the light of chasing and fighting the virus. So there is a drift at times, masks, no masks, application, surveillance or not. And we often forgetting the broader picture. So when we all say you have to identify, isolate, check the contacts, freeze the contacts, is exactly that cycle to try to fight and chase the, so all of those measures that are taken should be reconciled with this principle. Now, specifically on the social public health measures, Fiona and Brian. No, Fiona, sorry, Rosamund. Okay.
Rosamund, do you want to talk to what we see an exit strategy looking like at the moment?
So I would be reluctant to call it an exit strategy, though many people are using that term the same way many people are using the term lockdown. I prefer terms such as movement restrictions and transition. I think we need to realize that the new world, for better or for worse, will not be the same as the old world. And all the lessons that we're learning through this period of simple things like hand hygiene and physical distancing. Obviously, if you're playing a contact sport, then you're not engaging in the physical distancing during that match. But in general, the principles of how do we protect ourselves and each other from those simple measures of always having hand hygiene points available, of making water, soap, and maybe hand sanitizer available where possible. These should be things, these should be habits that we have acquired during this phase that are sustained and that are maintained. And even simple messages encouraging people to stay away from matches when they're not well is one that's really hard for the sports world because we want we want our players to play, and we want our teams to win, or at least to play the game. And but I still think it's really important that each club maybe identify, have a conversation, say what have they actually learned from this? What can they keep? What can they sustain going forward? So that there's going to be a phase where restrictions are lifted, but then they may be reimposed. And it's important for us to all collectively understand that this is probably going to last a while, and it may last for some time. It may last until we have a vaccine. It may last until the vaccine is widely available to everybody. We don't know yet how this is going to affect the population in a broader way once the actual sort of major part of the outbreak is over worldwide. And I say worldwide because we're always going to be subject to imported cases, which can then spark a new outbreak. So I think we need, and this, it's funny because this is not new. This is the same. We have measles outbreaks here and there. We have diphtheria outbreaks here and there. These are vaccine preventable diseases already, and yet our children, our athletes may not always be fully vaccinated. So you can look at this from a much broader perspective. You can stand back and say, what do I really need to protect the health of my athletes or other participants in mass gatherings or in events, whether they be local or global, and ask your people, bring your vaccination card. Why not? Because when you're going to then perhaps sometime in the hopefully not too distant future have COVID-19 vaccine to offer, it would be quite silly for us to offer COVID-19 vaccine and not check the measles vaccination status of every player. So I know I'm kind of going off track here, but I just want to say that number one is lessons we can learn from this, and let us each at our own level examine what those lessons are and what the principles are driving us forward, which is to keep our players healthy and safe so that we can play a better game. And if we have that as a driving principle, then you might go so far as to ban smoking from your sports clubs. I don't know, I'm just throwing stuff out there. So but with that kind of framework in mind, there's a lot you can do, and you can really motivate both players, coaches, managers to see the game in a holistic way, which I think will benefit all of society. And number two, being aware that lifting measures, as I've already said, may hopefully stay that way. And gradually what was recommended today by the Director General of WHO was that, of course, this is a result of discussions and work with a number of partners, was that, for example, countries may consider lifting one measure at a time. So it's not going to be the way the measures were implemented in the first place, where workplaces were closed. Well, first of all, of course, your sporting events were the first to suffer. But thereafter, workplaces were closed, schools were adapted to online learning where possible, etc. So these are going to be lifted by each country and each local area in a measured way, hopefully, and in a progressive way. So one local area might say, okay, we're going to let kids go back to school first, or other area may say, we'll let people go back to work first in what hitherto were known as non-essential services. Of course, they're essential. They're essential to the economy and to society. But it won't be all at once. And so we can adapt progressively. And in that conversation at the local or national level, you can contribute your 2 cents worth and say, we think we can hold this type of event safely because we can put in place these types of safeguards. And you can, mindfully advocate for advancing your cause if you're able to say, yeah, let's do things a certain way.
Rosamund, Maurizio here. It's actually also true that on this topic, everybody has an opinion, rightly so.
Yeah,
that touch their own life. So if you do a plumber, you should say the plumber go first, and so on and so forth. So it's an open debate, and we try to bring it back to the basic public health principle. Because if you close something, you reopen something else, and via. Very, very important indeed.
So can I just jump in there, because I completely agree with that. And the basic public health principle that you'll hear WHO at least advocating going forward is continue to detect new cases and trace contacts, right? So if your club is, your activity, your sport has still cases appearing of COVID or measles or anything else, then and your local public health unit is asking you to participate in contact tracing, identify people who are in contact, the collaboration of the sports federations with the public health services will be really, really important to gain the trust that will allow you to move forward with your activities. If the public health services have the trust that if they do find a case amongst the ranks of the players, that appropriate measures will be taken, and that public health will remain a primary concern. Does that go along with what you were thinking, Maurizio?
Yes. Now, the question on the risk assessment, and when is the right moment to conduct the risk assessment for an event? The first answer is that whatever you do, it is dynamic, because the situation of the event, of the population, of the outbreak is changing so much that is dynamic in nature. But I refer this to Tina and Brian.
Brian, would you like to comment on that? When is the best time to perform the COVID-19 risk assessment tool for an event?
Mute.
No, he's not on yet. Tina, perhaps you'd like to try?
So I think that actually it will be good to use it as soon as possible, because it will help you make that initial decision as to whether to progress plan in the event. We're starting to have people use it and getting some feedback. So for us, that will be a very valuable thing to receive as well. But like most of these things, planning for big events takes years. So the earlier that people can use it, the better informed they'll be. But bearing in mind all the discussions that have been going on about the rapidly evolving and changing situation and the different contexts in which these are taking place. But the risk assessment, the toolkit will absolutely help make those decisions and we'll probably raise some other questions that we can hopefully help to answer and respond to. But unless you go through that process, it will be a very difficult decision to make. If you're saying we can't carry on, it will give you the evidence base to support that decision and vice versa. So please try it, use it as soon as possible, and we'll work with you to evolve it and enable it to work for you as well. Over.
Thank you so much, Tina. We have a number of questions coming through about testing and diagnostics, and we unfortunately weren't able to get our diagnostics on the call today. So what we'd like to propose is that we park these questions until next week, and then next week we make the testing and diagnostics a key focus area for this webinar, and we will answer all the testing related questions on that webinar.
And I see there is John De Fiori from the NBA with us. And on the topic of reopening, but also the closing and the risk assessment, I think that John's opinion to be shared would be very, very valuable. John? And thank you for joining us so early.
John, you're on mute.
Can you hear me?
Yes, that's better.
Hang on one second.
You're doing echoes.
There we
go. Okay.
John?
Let me try a different way.
Okay, we'll go back to you. So now when you fix the problem, you flag it back and Sarah will redo it.
I wondered, Mauricio, if I could make a comment, because I see a few questions are asking around the community sport. I know a lot of interest around the larger events and the more professional end of the sports and recommencing those. But
absolutely.
There's a question about some sort of risk assessment of different forms of physical activity. I see one there on golf as a particular example, perhaps because one can more likely implement the physical distancing in such an activity. Would your team be able to comment on the applicability of the current tools for assessing a sport like golf and other community-based activities, recommencing those community-based activities? Are they ready to go, or do they need adaptation? Over to you, Mauricio.
We were saying, just the example of golf in the past, one of the past webinar, when we assess the risk, there are two moments. A preliminary screening flowchart that says, if the country is locked down, stop here. And there is then the simplified risk assessment that when you actually can think of reopening the sport under some mitigation measure, that's where you think and start. Golf was one of the examples. It's in general elderly rather than young, and is open. While you have an indoor skateboard competition, is obviously more likely to be young spectators and less prone to the disease. So in those type of reflection, you have to add, and this is the 90% of the question we are having today is how to protect the athletes, how to test, should they have a passport of immunity. What we bring at the table, Fiona and colleagues, is the public health perspective. How do you go to the golf course? Are you driving, taking the bus? Are you taking note of the contact tracing? Should somebody you play golf with or at the buvette being sick? So it is this general awareness on how to insert sport or physical activities and so on into this cycle of chasing the virus that we were mentioning that before.
Thank you. Thank you, Mauricio. There's been a question also I noted about children. And of course, this has been a priority for WHO, and in children, of course, the importance of physical activity, and as they're out of school in so many countries for quite some time, how can support and provision be provided? And we know some schools are doing that, but I've also heard from colleagues in different country offices that some schools in other regions don't. So sharing of resources so that children in all countries can access some simple, enjoyable, fun ways of being active is very much an agenda. And from WHO, we really invite collaboration around that, and the making available of resources is very welcomed to support those. We're seeing some very nice things for those of you in Europe, 9 o'clock every morning, certain classes being live on TV, and some parents are finding other materials, but we always need more ideas. And so back to that first question, being creative, sharing them on social media, creating games and activities that can last over days and keep children active is a really high priority, not just for their physical health. Let's remember a very important topic that was mentioned at the outset, and that is our mental health as well, and the benefits of physical activity to our mood, our cognition, and of course sleep and feelings of well-being. So thank you for the question about that, and certainly WHO emphasizes the importance of helping parents and families keep everyone active, including children. Back to you, Sarah.
Thanks, Fiona. I noticed that Andrew, you would like to make a comment. Andrew, over to you.
And
thank you.
Just Chief Medical Officer of FIFA, Maurizio here, just to qualify, that is the spectrum, the other side of the spectrum. Andy?
That might be my colleague Andy Massey. This is Andrew Murray here. I previously worked for the Scottish Government in public health policy and now work for various sporting organisations, including the European Tour Golf. Just to say a huge thanks to the WHO for developing these very, very helpful resources. When we've used the resources in terms of the risk assessment was dynamically. So initially it was using the resource, working with the local public health authority, working with the local government and working with the sports body to produce that risk assessment, and then continuing to develop and continuing to monitor and then risk assess stuff on a continuous basis. So I think that the tool can be used in collaboration with governments and public health authorities at a point in time, but maintaining vigilance as to changing things in terms of national incidence and prevalence of disease, international competitors, type of competitors, etc. is very helpful, but great resources. I think the Be Active resources based on the WHO website, again, are fantastic. Some great slides that can be shared by federations to really encourage people to be active. And they're great. I guess my third question really is about the risk assessment tools are very, very helpful for professional sports and for mass gatherings. But in terms of adapting a version so that can be used to inform governments and to be informing governing bodies and those making these decisions about community sports, what are the key mitigations that can be put in place, I think would be fantastically helpful. And just to work out if there are any plans afoot to produce similar tools, but for the community level.
Again, thank you, Andy. There are two Andys on the planet. That one is golfing and the other is football. And of course, I always got confused. So I apologize for. They just co-author a paper soon, so it's not that they're not knowing each one another. Sarah.
Thanks, Maurizio. Specifically to Andrew's comment about adapting the risk assessment tools to community settings, is there a plan to do that?
There is, and one mantra that we repeated from day one: we can give guidance, we can send experts, we can help you to make decision, but WHO doesn't have any mandate to take the decision or to tell whether a testing is better than the other. Because if you are rich and you have an exceeding of testing, the testing of the football player would be good. If there are testing not enough for the nursing and the children, and we test the players, the society may take this as a bad thing. So is totally local, as Andy said, and this decision or imposition could not come by us. We can support, we can endorse, we can give tools, but nobody knows the community better than the communities.
Thanks, Maurizio. So we've had a question that came in over email and also one that's in the Q&A function with regards to restrictions around sports that involve exertion. So as and when restrictions are lifted, do you think there should be different rules for social distancing for mass gatherings that involve exertion like running or cycling? And then the question in the chat that's very similar is, do we know how running or dynamic movement enlarges the risk of contamination or safety area? As we've been saying, it's approximately no less than 1 meter. So Brian, I wonder if your microphone is working now. I know you had some trouble and perhaps you'd like to comment on those.
Can you hear me?
Yes, we can.
Oh, good. Technical problems. I think the logical assumption, Rosalind will know more as well, would be that any activity that increases lung activity, higher volume, higher speed of exhalation is likely to increase the risk of spreading coronavirus if the person is symptomatic or infected. So I think the logical assumption would be yes, it probably is. But in the risk assessment, also to the extent to which you can be sure that we're screening people so as not to be infected, then that's one of the mitigating factors for that. Over.
Thanks, Brian. We have another question from Andrew that says, in professional sport, players are most exposed and under pressure to return to play and help bring the economics of their respective industries back to life. How do you think competition organizers need to rethink training and match operations to ensure the health and safety of the players involved, as well as those in close proximity, such as support staff, coaches, doctors, etc., and other officials?
Thank you for the question. We have to think of it's not just as a performance system. So you have the singer on the scene, but also have the people making up the lights, setting up the screen, and the transport and the power. So for 11, it takes football, for 11 people playing, you have many other in the changing room, in the and all of those are different pressures. But at the end of the day, the economic of the event is shared by many. So it's true that there are union of players, union of worker of the stadium, union of bus driver for the teams. And especially we keep saying Juventus, Milan, or Manchester United. But remember, there are smaller clubs in the Serie B or smaller club. And those are semi-professionals and they are not taking the same amount of money. So there must be a graduality in doing this. And again, there are risks. There is no such a thing as risk zero. So whoever does this sport can hurt himself or have been exposed to something like in the past, but there are mitigation measures. When we have these mitigation measures, they collectively, all the actors and the acting in any event should take that decision.
Thanks, Maurizio.
So it's Brian here.
Please carry on, Brian.
I think it's an important question that sporting organizations and federations should also look to see how they can reach out to politicians to start that conversation. Because I think as countries start to lift the movement restrictions, there will at one level be a huge pressure to restart the high visibility events, you know, the ones with high sponsorship, big TV revenues, etc., the big competitions. But actually at the ground level as well, there has been a lot of people, you know, local coaches, volunteers, who have lost out over the lockdowns. And we need to find a way of balancing out to try and get both started off at the right time, but not to focus too much necessarily on the big events, but also to start getting grassroots people back involved, back earning money again. Okay, over.
I have a social dimension. So sport is post-pandemic. Rosamund mentioned that, and so did Fiona. Is having a different role, will be having a different role because he's more integrated in social, will be a driver. So he's not any longer entertainment industry or entertainment. It is truly one of the elements of the society most listened and referred to. And that will, together, we'll have to make that count. Sarina, actually it is.
Thank you, Maurizio. So a question from Mike on the chat. As restrictions are lifted, what are the guidelines for return to training for team sports, indoor and outdoor sports? Issues with sharing equipment, close confines, indoor strength equipment use, including spacing and sanitization.
John, could be, if John is connected.
John, are you online? Let me see. Maybe if I...
Well, while you look for John, it does seem that the theme going through from many of these is all about having that tool to help all different events at different levels, and particularly with a focus in this call on the community-based participation, whether that's indoor, in gyms, clubs, swimming pools, in the parks, and of course then larger events, community team sports and games, as well as those larger mass gatherings. I think there's been quite a strong call for some adaptation of those materials that were used for mass events to these very pragmatic opportunities and needs at the local level, and very much in that line as the discussion is going of how important stimulating people getting back out, getting the benefits of activity, but stimulating and reopening the economy and the social interactions. Sport and exercise, physical activity has got a very valuable role. And I think Rosalind made a point about establishing the trust and having the conversations and discussions now that there is mitigation being put in, and best practice can be shared amongst the relevant stakeholders in this field. So I think that's been a very, very useful emphasis that's been coming through the questions and some of the earlier responses. Back to you, Sarah.
And
Sarah, this is John DiFiore. Can you guys hear me now?
Yeah, we can. Thank you, John.
Yeah. So sorry about that. So I think there are a number of things that have come up on a couple of the most recent questions and comments that, you know, I think there's a number of other experts on the call, colleagues that will probably have a point of view. I think you've mentioned, Maurizio and others, that as the movement restrictions begin to potentially be modified, that there will be pressure to resume sports, particularly professional sports. But I think that it's very important for those of us who work with athletes to be very cognizant of protecting the health and safety of not just the athletes, but all of the coaches and staff and support personnel that allow us to put on sporting events. The politicians and others in the communities may not appreciate that quite as much as those of us who are directly working with and responsible for the health and safety of those folks. So it's very important to make sure that we are acting sort of with the health and safety being the fundamental tenet or of how we approach potentially restarting sport. And I think the other question relates to resuming, you know, training, and that's a very difficult one because so many of our athletes have never really been in a situation where they've not been able to participate in ongoing training at some level for this extended period of time. It seems unusual to say that, but for a lot of our professional athletes, they're maintaining at some level their conditioning. And so the risk for injury is a real one. And I don't think that we can really compare it to any other situation that has been faced, at least in US professional sport or certainly collegiate sport, where maybe there have been periods of time where there's not been competition, but there's been the ability to train either on your own with equipment or with personal coaches. Now we're in a situation where this is very different. People don't have access to typical facilities for the most part. And so organizing a resumption of play will necessarily involve a very well thought out, staged and phased process of strength and conditioning, team activities, and then probably some simulated competition before full competition. And then finally, I think the question was about how do you maintain an environment where you're trying to reduce the risk, including sharing of, trying to avoid sharing of any equipment. And that gets into very complex things that are dependent upon, I think, the type of sport, whether it's a team sport, an individual sport. How do you control the use of, for example, the weight room or the strength and conditioning area? And maybe that's along the lines of limiting access to certain appointment times where you have time in between to clean the equipment and before you allow in the next individual. But there are certain things that are going to be very difficult. For example, in the sport of basketball, what about the basketball itself? How well can you disinfect the basketball? And as soon as it becomes back in the play, people are handling it. And so when I say that, I'm getting to the point of relative risk, and that there will always be, well, for the foreseeable future, with the absence of a vaccine or certainly effective anti-pharmacological or antivirals, there's going to be some level of risk involved. And what's an acceptable level of risk, and how can we minimize that risk relative to the risk that all of us will have in our daily lives and our communities? So I'll stop there. There are many other folks on the call that I know that may have some thoughts about this as well.
Thank you so
for
much,
the record,
John.
the NBA athletes were the first one paying the salaries of the workers of the stadium and the ancillaries, so they were jobless by the absence of the play. So there is really active role that or lesson that we can take from you guys. Sarah?
Thanks, Maurizio. So I'd like to invite now Paolo Adami, who would like to make some comments on the work that's been done by the World Athletics on specific topics regarding endurance sports. So Paolo, over to you. I hope I've said your name correctly.
Yes, that's right. Thank you, Sarah, and good afternoon to all. I saw that some questions were related to the coming back to mass gathering events. In most cases, what I read were races. One somehow, I hope, reassuring information is that we just finalized as World Athletics the creation of a medical task force that will involve also chief medical officers from other international federations that are working of endurance sports. So we're talking about mass gathering endurance sports. We have involved the chief medical officers of the Triathlon Union, the Cycling Union, the International Rowing Federation, and Skiing Federation with regards to Nordic disciplines, as well as the International Institute for Race Medicine. So all endurance sports that gather several thousands of participants. And again, we're not talking about elite participants, but mass amateurs participants that, they join half marathons or even the fun run of their community. And we're looking into creating recommendations and guidelines with the support of experts indicated by the WHO to first come back or get close to our new normal reality, disseminate the recommendation to prevent future disease outbreaks in mass gathering events, then provide race organizers with the type of tools like the WHO has developed, like risk assessment tools or other mitigation and contingency plans. And finally, also with a keen view on scientific research, then to collect data and analyze this data to determine if COVID-19 survivors have an increased risk of developing other illnesses or injuries than what we know. We're moving into that direction. So I hope that this message is somehow reassuring to those that were posing questions about mass gathering events.
Thank you so much. I know you're correct. There have been a lot of questions on our Q&A with regards to that, and I hope that we can take the liberty of inviting you back on this call going forward to keep us updated on the work that you're doing and the recommendations that come out from your task force. That would be
absolutely.
We'd be delighted to have you.
With pleasure.
Great. I see we're almost at the time. We haven't answered all the questions on the call.
We never do, right?
We never do.
because it's part of the dynamic of any of these webinars. Makes that exciting and interesting.
Maybe we need to consider a 90-minute webinar for the next time. But anyway, perhaps we can reiterate that we'll do a special focus next week on testing, diagnostics. We'll get our experts on the line for that, and we can, so please send your questions in with regards to that specifically. I'd like to ask if any of our panelists would like to make a few short closing remarks.
It's Brian here.
Brian, please go ahead.
It's just partly prompted by the last two comments from John and from Paolo. I think one is we've got to be very clear that there is no such thing as zero risk, and there never has been. You know, and although we don't like to talk about flu and coronavirus in the same breath, but you know, we have done things with flu to mitigate risk, but we never get rid of it completely. So you need to keep that in mind. And as John was saying, we just need to think what are acceptable risks. And the other one then is that, you know, we need, as Fiona said at the beginning, to start being creative and think about new ways of doing things. So you know, if we want to run a half marathon, the first impression people get is you can't do that and keep social distancing. But actually, there probably are ways you can do it. We just never had to think about it before. So we need to start getting creative and thinking of different ways in which we can organize events, whether they're community events or competitive events, just to say, can we just sit back and think, can we do it differently in a way that tackles some of these risks? And the answer is probably yes for a lot of things that we don't yet have an answer for.
Fiona here. I'd be happy to make a final remark and a call, really, just to emphasize that getting everyone and supporting everyone to be active, from adults 30 minutes a day, is important. And whilst we focus on events and professional and athletes, it's every one of us being active every day, and we can each play a role in that. And I think many on this call have got enormous influence through your athletes, through your influence into communities, to get that message out. And what we're hearing from regional offices and country offices is help us keep the be active message going. So I really invite your participation and support in very simple, keep the message going, help people, be creative, and role model yourselves. Look forward to the next time to talk with you all. Thank you.
Thanks, Fiona. We will gather the questions that we haven't answered and make an attempt to try and answer those and share them over email, as well as the links to all the documents and tools that we shared at the beginning, and of course the link to the recording as well. We also have received a number of suggestions for topics, so please do keep those coming in. We'll keep a track of the information needs out there and try and go a little bit more in depth into certain topic areas going forward, try and focus a little bit more on specifics. So we do really appreciate your suggestions. Please continue to send them through, and we will do our best to meet those. Maurizio, any final comments?
Just to say thank you, and thank you to the panelists. Thank you for listening and the questions. That's very rewarding for us, because having a sense on whether what we do is helpful or not is always reassuring. And we should close this webinar reminding the definition of mass gathering that we have in mass gathering medicine, which is not depending by the number of participants. A mass gathering is a gathering of people that stresses the system, the public health system, in peacetime. And that refers back to the Brian comment on the zero risk or lack of zero risk, and many others. So it's not the mass gathering per se. In this time is the virus circulation, which are fighting, and any mitigation measure that reduce the virus circulation is positive and mitigates the risks. So it's not that there is a football match of 15,000 or 50 is a difference. It's where and how is this pandemic in that population. So bearing this in mind, it goes down to the small club of Fiona, or the gym, or is not the gene per se. All of those are totally positive if done in a safe way in mitigating the risk. So thank you again to everybody, and Sarah, as usual, to organizing this. And till next time.
Thank you, everybody.
Be safe.
Have a safe rest of the day.
Thanks.
Thank you. Goodbye.
Bye-bye.